Hello Pilates lovers! Welcome back to my channel, Annie Pilates Physical Therapist. And today is the second series for our low back pain or spasm with sciatic nerve irritation, which means a pain that starts from your back going down your leg. So if you're having this and you need some help, come and join me today. If lying on your back has no more shooting down your leg, then this is appropriate now. However, if you're still having pain, then do the first series that I did a few weeks ago that you can see in the link at the end of this video. So we'll start with engaging your core. We'll take deep breathing. Inhale through your nose and blow through your mouth. Pull your stomach in. Squeezing your butt cheeks. Keep your back in neutral. You can check it by putting your hand at the small of the back without pushing it down. Making sure you can slide your hand there. Again, take a deep breath through your nose. Blow through your mouth. Pull your stomach in. Squeeze your butt cheeks. And then imagining not to pee, so you engage your bladder. Again, take a deep breath through your nose. Blow through your mouth, pull your stomach in, and squeeze your butt cheeks. And in the end, imagining not to pee. One more breath, take a deep breath, and blow. Pull your stomach in, squeeze your butt cheeks, and imagining not to pee. We'll start with stretching your hamstrings. So we're going to do a sciatic nerve flossing. It's a nice stretch for the sciatic nerve. If your pain is in your right leg, you'll start there first. And you can do some ankle pumps 10 times. 3, 4, 5, 6, 7, 8, 9, 10. Lift your head up. So it's like flossing. When you lift your head up, you are stretching your spinal cord and it ends up stretching your sciatic nerve more while doing ankle pumps. You feel a pulling pain, but it's a good pain. 7, 8, 9, 10, and then back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you'll do side to side flossing of your nerve. You'll do it 5 times only. Feel a lovely stretch on your nerve. And then slowly go down. Even though if you're having pain only in your right, it is best to stretch both legs and both sciatic nerve to keep your back balanced and healthy. 4, 5, 6, 7, 8, 9, 10, and lift your head. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and lie down back. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Floss side to side. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And then slowly go down. The next exercise is stretching your piriformis muscle. So the piriformis muscle is a very deep muscle. It's tiny and deep. So when it gets tight, the sciatic nerve passes through the piriformis muscle. So in order to stretch it, if you're lying on your back, and if you're having pain in your right side, you're going to cross your leg like this. Hold the opposite leg and pull both of your legs towards your chest. And you feel a pulling pain on the leg where you cross your leg. So right now I'm feeling it on my right hip, very deep over here, and sometimes you feel pulling pain shooting down, which is normal. So you're going to hold it for a few more seconds. Take a deep breath and blow, so you relax the muscles more and you can do more relaxation. It helps the pain. And then slowly go down. We'll do it 3 times. So you go up, and this time you can challenge more by lifting your head up. Take a deep breath as close as to your chest. Feel a lovely stretch on your piriformis muscles. You take a deep breath and blow. And slowly go down. If crossing your leg in this position is already painful, you can always start in this position. Last stretch. Even just 3 reps for now is fine. And as you feel so much better in a few more weeks, then you can progress more. Take a deep breath and blow. Deep breath again, last stretch. And blow and gently go down. Such a lovely stretch. Now let's do the opposite leg. Even though if you're not having pain in your left, it is best to do it both legs to equalize the flexibility of your legs. So now gently bend your knee towards your chest. So now we're stretching your left leg. You cross your left over your right knee, settle around your ankle area, and feel a lovely stretch on your piriformis on your left buttock area. You take a deep breath and blow. Take a deep breath again and blow. And gently go down. And we'll do another one. You take a deep breath, inhale through your nose, and blow, and challenge yourself by lifting your head closer to your chest. It's such a lovely stretch on your piriformis. Inhale and blow down. And then last one, such a lovely stretch. You can also feel the stretch on your groin area, which is normal. If you're having hip arthritis on your hip and it's hard to do this, then just try your best. Just crossing your leg over your knee without pulling towards your chest. Last breath, take a deep breath and blow down softly. The next exercise is like you're gonna bend your knee towards your chest, like hugging both of them. And if there's no shooting down your leg, then you're ready. If you're having shooting pain, then stop and then go to your stomach and let your back rest in your stomach position. But if this is appropriate and you feel like there's no pain, then it's okay to continue. So from this position, you're gonna slowly twist both of your knees towards your sciatic nerve involvement. If you're having pain at your right side going down, then it's best both knees towards the right side where you have the pinch of your sciatic nerve. So slowly turn both legs, take a deep breath, and you feel a little bit pinch on your low back, which we call centralizing the pain. So when you are centralizing, it means there's more pain on your back area, which is better for your spine. But if your pain is going down your leg, then that's not the right exercise program for you. So now, for those who are having pain going down the left, then let's try. Then turn to the left. And if you feel a pinching pain where the nerve is irritated, usually the L5S1, which is the most flexible for bending forward, that's where you have the most bending and range of motion. And that's where the nerve gets irritated if you have disc bulge that causes sciatic nerve. So take a deep breath and blow. It's also common for people who have stenosis to have sciatic nerve, which means narrowing of the canal. So if you're having a stenosis, this is also safe for you to do. Because when you do this, you're not pinching your canal. You're actually opening your canal. Last one, you take a deep breath and blow. Okay, such a lovely stretch. And then now slowly go down. You might feel a little bit better now compared to before we start stretching. So now once you feel good on your spine, now it's okay to do some simple tabletops. And then take a deep breath. Tabletop is when you slowly bend your knee towards your chest. Engaging your core, inhale through your nose. And gently go down, blow through your mouth. Inhale through your nose. Bend your knee up to 90 degrees. Engaging your core. Still squeezing your butt cheeks. And blowing through your mouth when you slowly go down. Squeezing your butt cheeks. Take a deep breath again. Inhale through your nose. Pull your stomach in. And down, blow. If you can do tabletop now without shooting pain, then this is okay to continue. However, if it's a lot of pain and still shooting down, then go back again to my first video when most of the exercises are all in your stomach position. Take a deep breath and gently go down and blow. Lying on your back is very important for everyone. If you can't lie on your back, which means you're not ready, and blow. But this is a good goal for you to have a normal spine. Take a deep breath and blow. Feel a nice stretch all the way through your low back area. Take a deep breath and blow. The next one is butterfly. Butterfly means it's like you're flying. Instead of your arms as your wings, you're going to have your legs. So you're going to bend your knees and then slowly separate your knees apart while taking a deep breath. Pulling your stomach in. Keeping your back in neutral. You can check it by putting the small of your hand there. Squeeze your butt cheeks. And then blow. Imagining not to pee. To engage your bladder. Again, take a deep breath through your nose. Feels a lovely stretch in your groin area. Pull your stomach in and blow. Take a deep breath. Squeeze your butt cheeks. Hold it there. Gently put it together while blowing through your mouth and blow. Take a deep breath. Check your spine. Feel a lovely stretch when you're in this position. You might feel a pinching pain in your low back area, which is normal as long as it's not shooting down your leg. Take a deep breath and blow. And gently go back to the center. Inhale again. Hold it gently. Squeeze your stomach in. Squeeze your butt cheeks. This is such a lovely stretch for your low back area. And blow. Take a deep breath again. Inhale. Hold it there. Squeeze your stomach in. Squeeze your butt cheeks. If it's lying on your back in this position for a while now, you can always go back again to your stomach to stretch it out to back extension. And blow. 2 more to go. Take a deep breath. Feel a nice squeeze of your butt cheeks. Pull your stomach in. Feel a nice stretch in your low back and then blow. And then when you put your knees together, you can do an extra challenge by squeezing your knees together. So you feel a stretching, strengthening isometrics on your hip adductors. Last one. Last gentle stretch. Take a deep breath. And blow back to the center. Squeeze them hard together. And blow. Okay, now we're gonna lie on your side. If your sciatic nerve is on your left side, then lie on your right side with your left area where you have the weakness and pain on top. But if it's on your right, then turn around on the other side. So let's position ourselves now on your side. I'm focusing on one side, usually with sciatic nerve irritation, where there's one leg usually weaker because of pain and nerve irritation, you might lose some muscle weakness. So this area, we need to focus to strengthen them. And usually the gluteus medius, which is one of the gluteus muscles, located on in between the max and the minimus, are usually the first one that gets irritated. So you can also feel where the origin of the muscle, which is usually at the back of your, below, near the spine, on your pelvic bone, the posterior iliac spine, here. So when you feel your butt cheek area and you feel there's some tenderness, that's usually the origin of the muscle. And when you press it and put the rest of your fingers in front of your hip, we're gonna do some contract relax, which is a nice, lovely self-massage that you can do to help decrease the muscle spasm of your gluteus medius. Because once you have sciatic nerve irritation, usually you have a bad spasm on your butt cheek. So first, you're going to lower your knee down the bed like this, keeping your spine in neutral with your thumb on your butt like this. So from this position, you take a deep breath and slowly lift and kick back. And once you hold it here, you feel a little bit sharp pain in that area. And then when you press with your thumb, you feel more pain and tenderness, but that's fine. You take a deep breath, and then when you slowly go down and release, you feel a nice release of pain as well. So we'll do 5 times today. So you take a deep breath, inhale up, because sometimes you're not strong enough to do 10 reps today. And someday you can slowly increase the rep up to 10 times to do a contract relax that will help the spasm. And then blow down slowly. Whew, what a lovely stretch. It's like we're centralizing the pain more to our low back area. So you take a deep breath up, gently. You feel that area getting tired and fatigued. So we're also strengthening as well, not just releasing the spasm. So we're hitting 2 birds in 1 stone, which is a lovely workout. Take a deep breath and gently go down and blow. And the beautiful exercise program is so easy to do, and there's no impact on your spine, which is very gentle. You take a deep breath through your nose and down, slowly blow. Last one, you take a deep breath. You might feel so tired lifting it up, and maybe some of you can't even do 1 repetition. That's fine. Someday as the pain subsides, then you can do more. The next one is clamshell with a little bit challenge. You can start with this. This will help strengthen the gluteus medius, or you can challenge yourself in this position while still doing a contract relax with your thumb on the area where it's hurting you the most, the origin usually of the gluteus medius. You take a deep breath up, inhale, and blow. You might feel shakiness on your muscles, or you feel like you're gonna cramp, and you feel like you're cramping. You can always stop and relax. And then you can do it again the next time. You can do it later or tomorrow, so you're not overdoing your muscles and the nerves. You take a deep breath, inhale, Engage your core muscles and blow. Take a deep breath up and down, blow. Heel up and down, blow. Take a deep breath and down, blow. Last one, take a deep breath and gently go down below. The next exercise is called PNF, D1 flexion and extension. It's called proprioceptive neuromuscular facilitation, because when you're having low back pain with sciatic nerve, you have a limping gait. And once you have a limping gait, your brain gets confused on how you walk properly. So this pattern helps retrain your gait pattern. So even inside lying, I know we're not in walking position, we are doing the mechanics on how we should walk. So the first one, if this is your weak side, you're gonna kick your leg forward up with your toes pointing the ceiling. And then if you want to stabilize, you can bend the lower part of your leg. Take a deep breath and then go back to the midline and then kick back like the first exercise when we're doing the gluteus medius release. You feel it again, the same muscle group, and then you kick forward. So this is the next challenge. Kick forward, toes up, pointing the ceiling. Take a deep breath. Go back to midline and kick back with your toes this time pointing the floor, so you're internal rotating your hip. So you go up again, take a deep breath. So today is not just Pilates based, but also physical therapy treatment. So I'm combining both to help people with low back pain. And most of my cases in my work area are low back pain or sciatic nerve. And through the years, I've been treating different cases, and I've seen all of my exercise program work well with my patients, and they love it. Especially if you do your homework, which means you have to do your exercise every single day to keep your muscles, nerves, and joints flexible. So you take a deep breath, toes pointing up, and then down, blow towards the back. You can push, contract, relax. Take a deep breath. You might get really tired now. You don't have to finish everything. If you're tired and you're cramping, you can always stop and rest. And last one. Take a deep breath forward, toes pointing the ceiling. And then back, pointing down the floor. And gently go down. So we did at least 4 exercises on your side. Now we're going to end our program in our stomach position. It's nice to cool down now, because usually with sciatic nerve, it's nice to go to your stomach. And this is what we call Mackenzie exercises. And I'm going to combine Mackenzie with my Pilates techniques. So you're going to take a deep breath on your stomach first and blow. Just resting in your stomach helps relieve the irritation of sciatic nerve. One more breath. Take a deep breath through your nose and gently blow through your mouth. Squeeze your stomach in. Squeeze your butt cheeks. And then still imagining not to pee, to engage your bladder. One more breath, and even in this position you can feel centralizing of your pain, which is better for your back as long as it's not shooting down. Just take a deep breath through your nose and blow. So now we're going to do with your elbow, prop on your elbow while looking up. Take a deep breath, and when you blow, lower yourself. Take a deep breath up
And gently go down. Take a deep breath up. And down, blow. Such a lovely stretch. Take a deep breath. And down, blow. Take a deep breath. And down, blow. And up. And down, blow.
This exercise is also good for patients
or anyone who's having back spasm. So instead of taking your muscle relaxant, if you're having pain from L1 to L5, if you strain your spine by doing something at home or sports, this is a nice way to end your day so you feel good. Next progression is prone on your hands. So gently you're going to push with your hands up. Take a deep breath. And down, blow. Take a deep breath up. We'll do 10 times. Feel a lovely stretch on your low back area and then down, blow. And the pain is usually now more on your back area and not shooting down your legs. And blow. Deep breath up. And down, blow. Deep breath up. It feels lovelier and the pain and the spasm on your back will slowly subside more, which is lovely to end your day so you have better sleep at night. And blow. 2 more to go. Take a deep breath. And down, blow. Last one, you take a deep breath. Look up as high as you can. And gently go down, blow. So the next exercise is single knee bend. It's an exercise where you slowly bend your knee, one knee at a time. If your sciatic nerve is on your left, you'll start on that first. And if it's on the right, then you start on the right. And when you bend it, you feel sometimes shooting pain down the leg. It's like you're flossing again. Flossing is a good way to stretch the irritation. So you slowly go down and rest first. And then now we're going to do single knee bend. Put your head down, and then now you're going to slowly bend your knee. So you might feel a shooting pain down your leg. If it's just normal, it's like flossing. You take a deep breath. Still engage your core muscles, pull your stomach in and blow. And it's best to do alternating to equalize your spinal flexibility and strength. And if you keep your head down straight down like this, it's best also, so you're not hurting your neck. You take a deep breath. And down, blow. Right leg, inhale. And down, blow. Left leg, inhale. Squeeze your stomach in, squeeze your butt cheeks. And gently go down and blow. Inhale. Squeeze your stomach in, squeeze your butt cheeks, and down, blow. Every time you squeeze your stomach and your butt cheeks, you might feel more pain on your back, which is you're centralizing the pain, which is normal.
Take a deep breath up. Squeeze your stomach, squeeze your butt cheeks, and down below. Inhale. Squeeze as hard as you can and blow. Inhale and down below. The next one is double knee bend. So you're going to bend both knees this time while taking a deep breath through your nose. And down below. Such a lovely stretch. You can feel some centralizing of pain in your low back area. The deep breath. And blow. A deep breath. And down blow. A deep breath. And down below. Deep breath. Squeeze your stomach in, squeeze your butt cheeks, and blow. A deep breath. And down below. 2 more to go. Take a deep breath. Stomach in, squeeze your butt cheeks and blow. Last one, take a deep breath and blow. And after doing all of these, your back might be a little bit tight now. So it's best to do some child pose. You can separate your knees apart like this and slowly sit in your tush towards your heel and reach as far as you can. Take a deep breath and blow, and feels good in your back. Deep breath and blow. Last breath. Take a deep breath and blow. And then slowly go up to your hands and knees and do some back extension on your hands again. Now it feels a little bit different now because you really release a lot of spasm in your back. And go back again to your child pose. Take a deep breath and blow. Take a deep breath and blow. And back to child pose. Hold it there. Take a deep breath. Squeeze your stomach and squeeze your butt cheeks and blow. Last breath, deep breath, and blow. Next one, you're going to go to your hands and knees and we're going to do some cat and camel. Cat is like this, like an angry cat. Pull your stomach in, hunch your upper back. And camel is your doing anterior tilt of your pelvic, and then looking up, and then you feel a centralizing pain on your low back area. You take a deep breath and back to the angry cat. Stomach in, squeeze your stomach, squeeze your butt cheeks, and blow up to camel position, centralizing your low back pain. Inhale and back to angry cat. Feels a lovely mobilization of your spine. It's like you're doing your own stretch and massage on your low back area. And blow. So what you're stretching is really deep muscles that sometimes can't be reached with a massage therapist. And when you do this, you're doing a self-massage. It's like a self-love, self-healing that you can do in your own home. Where you're having a lot of pain, sitting all day with your work, or maybe a lot of standing and walking. And it's nice to do this at the end of the day before going to sleep.
breath. Stomach in, squeeze your butt cheek, squeeze your stomach in. Take a deep breath and then blow gently up. Slowly and surely. 2 more to go. Take a deep breath. Stomach in, squeeze as hard as you can. And up, blow. Last one, do your best. Stretch as much as you can. Punch as high as you can. And go up gently and blow. And now, let's do a little bit child pose again. Stretch gently. Take a deep breath and blow. 1 more breath. Take a deep breath and blow. And then back to hands and knees and prone and hands. Love to stretch. And challenge yourself with bending both knees to get better stretch on your hip flexors. And your low back is centralizing more. Down to child pose again. 1 more beautiful child pose to end our program. Take a deep breath and blow. 1 more breath and blow. It was such a nice Pilates physical therapy combination stretching that we did today. We focused mostly on stretching, and if you look back in my previous video, I did some sciatic nerve irritation on this side of the channel, and it's mostly stretching also, but there's some strengthening that was done. But it was a pleasure working with everyone, and if you're having more pain, then stop. If you're feeling much better, then continue, then add more repetitions to this program. And you can always go back to the previous video as well, switch back and forth. And if you're having a normal spine, no pain, then just join me to keep your spine healthy. Thanks again for watching. Please like and subscribe my channel. It would be nice to see everyone back. And leave a comment for any future suggestions for my next video. Thanks again. Bye.